what is implicit in Section 25 of the Constitution.
Well, the EFF talking about land this week. Earlier today on Newzroom Afrika, Channel 405, you would have seen the leader of the EFF, Julius Malema, also talking about the South African Health Products Regulatory Authority. The EFF demanding that SAHPRA immediately allow or register the use of the Sinovac and Sputnik vaccines, which are made by China and Russia. SAHPRA has now said it's still awaiting the full information from the manufacturers of those vaccines and the Moderna vaccine. Dr. Boitumelo Semeta is the CEO of the South African Health Products Regulatory Authority. She joins us now. Doctor, good evening to you and thank you for your time. Firstly, what kind of information do you need about a vaccine before you will register it to be used in South Africa?
Sure, thank you. So our mandate requires that we look at information that pertains to the safety of a vaccine, that speaks to its efficacy, as well as its quality. So those are the three, sets of information that require from every applicant. And until the regulator is satisfied with what has been provided, it therefore then cannot make a regulatory decision.
Who in SAHPRA actually makes the decision? Is it the board? Is it you as the CEO? Is it Professor Helen Rees as the chair? How does that work?
Yeah, so the decisions of SAHPRA are decisions of the CEO, and the CEO, I consult with various experts in the relevant scientific disciplines. So these are decisions of the CEO. The board does not get involved in any process, operational business of SAHPRA, no issuance of licensing or registration of vaccines at all.
I would imagine the data matters. When it comes to vaccines, you're looking at numbers to prove that they are safe and that they're actually effective. In other words, if you want to register a vaccine to use against one variant of COVID-19, you need numbers that prove that it works. It's a numbers game.
Indeed, and that's why, you've got international standards on how clinical trials should be conducted. And those standards would indicate minimum requirements of information. And so that's what we consider, and that's what we then require to ensure that the data that we receive does indeed satisfy those regulatory requirements.
So you've registered the Johnson & Johnson and the Pfizer vaccines, not the Moderna, Sinovac and Sputnik vaccines. What do you need from them?
Sure. So at the moment, we do have an application from Sinovac as well as an application from Sputnik. We have not received any applications yet for Moderna, for Sinopharm, as well as Novavax. So even though these are vaccines that have been registered in other countries or may have a WHO emergency use listing, until we have an application wherein we review the data, we then cannot, make a decision on that. So we don't have those three at the moment, but we are evaluating Sinovac and Sputnik.
So whose job is it to get the data to you? You don't get the data yourself, they give it to you, the manufacturers. It's up to them.
Yes, indeed. I mean, we would be conflicted if we get the data ourselves. So the manufacturers have to ensure that they generate the data that we require. And I mean, we have constant engagements with them, clearly indicating what are the minimum requirements to enable us to make a decision.
So at the moment then, from what you say, Doctor, any hold-up actually comes on their side. The ball's in their court. It's not in your court as SAHPRA.
Indeed. And I mean, as I've said, we have numerous engagements with them. Whenever they provide us data, we review that as expeditiously as we possibly can. And we get back to them and we say, here are, more data that we require, or here are some of their queries, and they need to provide us that. And if the data is not satisfactory, we are not able to make a decision, because our mandate is to ensure that every single vaccine that's available in this country, it does meet those qualities of the fact that it's safe, that it's an effective vaccine, and that it's a quality vaccine. If those are not satisfied or satisfactory to us as a regulator, we cannot make a regulatory decision.
The claim from the EFF, and they put this in a statement on Friday, and then it was repeated again today, is that your chair, Professor Helen Rees, is conflicted because her husband owns shares in Aspen. How do you respond to that charge? Is that true?
Yeah, I'm going to ask that you engage with Prof. Rees herself on this. And so I would rather not comment on this matter.
I mean, it's clear for the moment that you're under pressure, political pressure. The EFF wants to march against you. To my memory, this is actually the first time that the Health Products Regulatory Authority has been put under political pressure from a political party. How do you respond to that?
Yeah, I mean, as a regulator, we really are an independent body. We work autonomously. We concern ourselves with the science of health products. We cannot concern ourselves with anything else. And so while the public and whichever constituent does have the right to march and to protest, it's a constitutional right. However, we will make a decision when we are satisfied as a regulator that we've got all the information that gives us the confidence that whatever vaccine that we will say is available in the country, it meets those requirements. And so, we continue to stick to what we know. I don't know politics. I'm not a politician. I know science, and that's what we're going to focus on.
In a way, this issue, I think, is going to be put in these terms, that you are biased against vaccines from Russia and China, and that you are, for some reason, supporting vaccines from the West, the United States and Europe. I presume you deny that.
Completely. As I said, as a regulator, we're a neutral body. We don't have any political interest at all. And so whatever application we receive, we apply the same rigor across the board. The types of discussions that we are having now with the current applicants are the same discussions we had with other applicants. The process that we're applying on vaccines is a process that we've applied for medicines. Last year, we focused a lot on medical devices. Again, we were quite rigorous. And so we pride ourselves in being consistent with our approaches. We pride ourselves in that we make decisions based on science and nothing else.
Dr. Boitumelo Semeta, CEO of the South African Health Products Regulatory Authority, I do appreciate